male PT was doing roof repair. PT had a fall from a ladder. PT is now unconscious.
Good evening. I am Sanjay Reed, EMT attached to the Negril Fire Station, and today I'll be doing assessment on a trauma patient. BSI, is my scene safe?
Yes.
Is this my only patient?
Yes.
Based on the mechanism of injury, which is a fall, I will consider C-spine immobilization, and I will also consider ALS intercept. I'll now approach my patient in his line of sight, and let me first say the general impression of this patient is a male of an African descent, seems to be in his early 20s, and it is lying supine on the ground and appears unconscious. I'll approach him in his line of sight. Hello, sir. I am EMT Reed, and with me is my partners from the Negril Fire Station. If you can hear me, please do not move your head. At this point, I'll call my partner to stabilize C-spine. And in doing so, I'll also instruct him to open the airway via the draw thrust maneuver. Right. What I'll do at this point, I'll simultaneously check for a carotid arch while I do listen and feel and check in. Horizon fall of the chest. I'm checking for symmetry, and I'm checking for adequate depth. At this time, I'll use my stats. And I'll auscultate, starting with the apices. I'll go mid-axillary, and I'll also check the low field. And his lungs are clear in all fields. I'll also check for rate, and in doing so, I'll check for a period of 30 seconds, in which I'll times 2. And my patient has a respiration rate of 24 breaths per minute. What I'll do at this point, I'll obtain a saturation and room air, in which I'll attach a pulse oximeter. And my patient have a saturation of 90. So I'll administer oxygen via an rebreather mask at 15 liters per minute. I'll now do a rapid scan, in which I'll check for DCAT, BTLS. I'll check the head. I'll do a blood sweep, check for any signs of blood. I'll check for cerebrospinal fluid in the ears. I'll check the nostril, I'll check the mouth. I'll also check for pupil reaction. I'll expose. I'll check for symmetry. I'll check the pelvic for rigidity. I'll check the lower extremity as well. I'll expose. I'll check for a dorsalis pedis pulse that is present. I'll check bilaterally. I'll expose. And I'm seeing here an avulsion with minimal bleeding. So what I'll do, I'll control bleeding, and I'll apply a dressing. after which I'll check circulation. I'll check bilaterally for radial pulse. I'll check his skin color. I'll check for pallor. I'll check his cap refill, which is more than 3 seconds. I'll check his temperature. Which is 36.4. I'll also check now for trachea deviation, and I'll use the 3-finger technique in doing so. I'll check for jugular vein distension. Here's none present. Having done my DCAT BTLS of the head, I'll apply my C color. And we have a priority patient, so this is a load and go case. So I'll make my decision prior to doing all of this. So at this time, I'm going to log roll my patient. And I'll ask for the assistance of my partner.
Over 3. 1, 2, 3.
At this point, I'll do a DCAT BTLS of the posterior. I'll check. And also auscultate. And an auscultation, his lungs are clear in all fields.
Over 3. 1, 2, 3. One, two, three.
Right.
1, 2, 3.
I'll ensure to strap my patient properly, and I'll use a head block for additional support for stability. I'll now transport my patient to the ambulance where I'll do a set of baseline vitals. I'll check his oxygen saturation, and I'm seeing signs of improvement. I'll check his temperature. I'll check his lungs. And I'll obtain a blood pressure reading. And my patient has a blood pressure reading of 110, systolic, with a diastolic of 70. As mentioned earlier, it's a priority patient, so en route I'll assess every 5 minutes, and upon reaching the facility, I'll indicate my findings. But with me is one of his family members who indicated that he does not have a medical history, and what he had to eat last that he can remember was a bowl of porridge. So I'll further furnish the hospital or the medical facility that I'll be transporting him to with the necessary information in terms of my findings and my intervention. Thank you.